Welcome back to GH2 Unfiltered Medicare ABCs, the Masterclass. Today, Medicare Advantage. So the most dramatic change to the consumer choices that you face is the dramatic improvement in Medicare Advantage compared to Medigap, which I presented in a prior session. 35% of the market Medicare Advantage, certainly in certain locations around the country, more than 50% already, probably headed there nationally. The fact of the matter is my counterparts on YouTube or other locations and other presentations aren't as even-handed as I will be. And the simple reason is that, commercially speaking, it is a lot more difficult for people like me to get aligned with Medicare Advantage. Why? We've got to pass a test for every carrier in every location. So as opposed to Medicare Supplement or with Medigap, we can literally flip a switch and turn on our permissioning across the country if we have a license in a particular state. In Medicare Advantage, you've got a whole extra set of layering. This is a powerful disincentive, right? Because you need to understand that this inherent bias here exists by the brokerage and producer community, which is to dissuade you away from Medicare Advantage. Nevertheless, the fact of the matter is I don't have that view. And the reason I don't have that view is not because of the inherent differences between Medicare Advantage and Medigap. Medicare Advantage, I think, is the order I used in a prior session. As long as you understand what these inherent differences are and the accompanying risks and outcomes, what they could be, I'm okay with whatever you choose. Let's get started. Medicare Advantage is known as Medicare Part C, from the past. That's kind of a historical way of answering, what Medicare Advantage is. So what ends up happening here, as you can see in the first section of this slide, Medicare Advantage is annual contract. So again, from Part D, I explained what annual contract and what the implications would be, which is that every moving part in Medicare Advantage is subject to change every single year. It's a very important thing to remember because what's happening is as more Medicare Advantage carriers, insurance companies are entering every single market in the country, save, Alaska and a small county in Maryland, more Medicare Advantage entrants every year, more plans. It's not going to get less populated. Your number of options is going to increase. So you can put yourself in the seller's shoes. The only way to differentiate yourself across 40, 50, Miami-Dade 60, 70 plans is to tweak the little dials so that some particular dial fits you best. And so as a result, that's the reason that you have to understand that Medicare Advantage is annual contract. The second bullet point here has also powerful implication, which is everything handled by the private company, which is the Medicare Advantage carrier. So basically what happens is you pay premium, which can be zero, by the way, for Medicare Advantage. We'll get to that in a moment. All administration of everything, all decisions, all definitions, all driven by Medicare Advantage. All of it. Now, that doesn't mean that the carrier is making stuff up. Because in order to get permission to call itself Medicare Advantage, they had to meet a set of criteria. They had to get approved by the federal government. And the reason I slowed down here is because sometimes there's a controversy between the patient, policyholder, and the Medicare Advantage company because the policy owner doesn't understand these mechanics. Okay, so this is why I'm trying to make this very, very clear. Third point, every Medicare Advantage plan must be as good as original Medicare on average. So this is me speaking slowly again, and now I will flex all the letters after my name and educational background, which is that when I say on average, and someone like me uses that set of language, it should set off your radar. And I'm doing so intentionally. Because you can remember that I explained, for example, over here, let's just go to Part A and Part B summary. And I went to what the excess charge is, and I went how the setup is, and the fine print on how deductible and benefit periods work under Part A and Part B. Those are all overridden by Medicare Advantage carrier. All of them. Okay. They get to determine what the definitions are. Now, that said, as a set of benefits, it must be, on average, better than the federal card alone. That does not mean that every single line item is going to be better. It doesn't. It's a very important, subtle point. It leads to misunderstanding about what Medicare Advantage actually is. The second section of this slide is just, fairly boilerplate and clear. Most Medicare Advantage plans, over 90%, include benefits that look like Part A, Part B, and also combined prescription drug benefits. This means that you cannot have Medicare Advantage plus a Part D plan, unless it's a very specific subset of Medicare Advantage plan called PFFS, which doesn't really exist in many locations. As I explained, every one of these Medicare Advantage plans will define what all of the deductibles, co-payments, co-insurance will be for every service. And this is not necessarily negative. The candid reality is because the market is this competitive, can you find inpatient hospitalization deductible or going to Part B deductible is zero? The answer is yes. It's not even $203. Can you find a Part D prescription drug benefits with the deductible is zero? The answer is yes. It will not be $455. Right? So in other words, what ends up happening is the carriers are sitting there competing on each one of these details aggressively. Of course, aggressively. There's a market of 65 million Medicare policy owners in general. So if you're talking about 50% on Medicare Advantage, you're talking about 30 million buyers. It's a big market. The third point in this second section is vital. It is about network. So the way you're here at Medicare Advantage. So for some reason, the financial reality is you're choosing Medicare Advantage for some set of financial priority. For example, maybe you live on Social Security alone. Maybe you are, like me, a penny pincher, cheapskate, trying to save every dollar and assigning it a very high probability. You're Mr. Perfect, you're 67, you've never been sick. You don't want to spend $140 a month for Medigap that I discussed in the prior session. That is absolutely your prerogative. That said, you need to understand that there are networks. The way to get the most for your Medicare Advantage is stay inside the network. That doesn't mean that you can't see out-of-network providers, but you need to choose the Medicare Advantage plan that allows this. There's a reason that the lights stay on here, which is that you can see among the 60 plans in Miami-Dade, I'm helping people choose amongst them so that they get fitting of the network first and foremost. The last point doesn't really apply to most, but you need to be careful because what ends up happening is people look through all these little details and go, oh, that's the plan I want. But then find out after the fact that, oh, oops, that's one of the 10% of plans that doesn't have prescription drug benefits attached. This is to be avoided if you don't have prescription drug coverage from another location like the VA. Okay? So as a result, you can see the Medicare Advantage is all in one, and the carriers are intentionally trying to make it look and feel like individual health insurance or group-sponsored health insurance before you turn 65. Okay? So they want you to transition to it and feel comfortable with it, and so as a result, Medicare Advantage looks and feels similar. Ultimately here, as a result of this introduction, if you think through what I've been observing about Medigap, you have basically Medicare Advantage lower monthly cost. Almost every location in the country has a Medicare Advantage plan that costs $0. Okay? So there, you have to have Part A and Part B. You cannot get away from that. So that's equal, irrespective of whether you're choosing Medicare Advantage or Medigap. The thing that you now get to save is this $100 a month for Medigap, right? For example, the 65-year-old, I said that a 65-year-old in many locations in the country, Plan G can cost $100, $110, in which case you can save that, and now that number is $1,200 a year. For certain households, that's worth it because that person, if, for example, having no health situations, no medications, etc., that all said, what you cannot get away from is what I've explained in the upper two section of this slide. It's the entire section, this entire session about Medicare Advantage should be about this, which is you cannot get away from these inherent differences. Right? There's going to be network in Medicare Advantage. And then there can be ripple effects on Medicare Advantage. Right? Like what? The carrier and the hospital system disagree. And the carrier says, you know what? We're done with that Medicare Advantage plan. That can happen. That has happened. That will happen. Right? Because there's going to be this debate about how much the hospital is going to get paid if you go inpatient and haul in your Medicare Advantage card. Every single detail is up for negotiation. And there's certain medical systems or doctors who are just going to say, you know, I can't accept that amount of money. My work, I'm too busy, the costs are too high, etc. They're going to have their own reasons. We're not here to adjudicate who's doing the right thing. Really, I don't have a stake in that race. What I do have is the stake that makes sure that you understand these details. And on it goes, right? I mean, in other words, for example, the idea of prior authorization. You can remember what I've just said here. If you look at this second point on the first section, everything handled by private company. What does that mean? Medicare Advantage plans absolutely have the unrestricted right to make this prior authorization a requirement. You, as a Medicare Advantage plan carrier, you don't have a vote here. You do get to have this prior authorization process. That doesn't mean that you have to agree with a conclusion. There are ways to appeal. Okay, and there are grievances that you can file. For example, beyond today, even beyond Medicare ABCs. Maybe an extra addenda later. But because of this, this is the central choice you're choosing, right? So in other words, we've got these little ripple effects as a result of Medicare Advantage. That said, you have cost superiority. These cost superiorities aren't trivial Because the reality is that even inside the plans, Part D, for example, sometimes the medications inside Medicare Advantage plans are far better than the standalone prescription plans. So now again, you're back to counting dollars, which is in many cases, Medicare Advantage can be superior, especially for those persons who desperately need every dollar and also want to be very, very economical, and also those who have specific combinations and have networks which are very good. What can end up happening is Medicare Advantage will look and feel superior to Medigap. That is entirely possible. It's also, that last sentence, also entirely absent on YouTube in public. I started this session with my speculation or thought process on why that could be the case. And as a result, you can see this here, which is Medicare Advantage expanding rapidly. If you're hoping for less mail, fewer commercials, less infomercials going forward, don't hold your breath. This is a one-way train. And don't get me wrong, you could say to yourself, okay, why is the federal government sending all these? Isn't this just pure profits to insurance companies? There is a real rationale here. If someone made me czar of the CMS, no one is, you could say the argument could run is push down the money to Medicare Advantage and let them negotiate down the cost of inpatient hospitalization and healthcare services. This is this idea. Let the leverage of the huge Medicare Advantage carriers do the work to push down healthcare costs generally. That alone gives you a good rationale of why Medicare Advantage, it was never going anywhere. Never. Last thing here is this last point on the first section. Out-of-pocket maximum can be lower than Medigap premium. That is true. So a couple of subpoints here. The first subpoint is every Medicare Advantage plan must have an out-of-pocket maximum. So now you can understand the PSA, public service announcement aspect of every session that I actually run in public. Someone you know has the federal card by itself. This is not a good idea. Why? Because as you can see right here, no annual limit on out-of-pocket expenses if you have the federal card alone. Under Medicare Advantage, at the worst, you can pay zero premium and add it to my last point, which you must have an out-of-pocket maximum. There's no such thing as Medicare Advantage plan without an out-of-pocket maximum. It must have one attached. Must. Otherwise, they don't get approved. This is why I'm saying, for those persons who think, okay, well, I hate Jay, I don't like insurance, I don't believe in any of this, etc., 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 please help them get over this. Why? Because you can pay $0 for Medicare Advantage and still have an out-of-pocket maximum. For those persons who are not fortunate financially, for whatever reason, this can literally save a household from bankruptcy. Literally. Down here at the bottom here are some important new facts about end-stage renal disease, ESRD, and dialysis. In 2021, this is the first year that anyone with ESRD can have Medicare Advantage plans. In the past, this was not the case. This left people who required dialysis stuck. So, what happens here is you are now unrestricted acceptance. This is important stuff. It's thousands of dollars a year. Because for those of you who know anyone on dialysis, it is very unlikely that you have dialysis alone. You have other medical health care needs, right? As a result, the fact that you have coverage under Medicare Advantage and an out-of-pocket maximum, it's very important for those persons at least to have Medicare Advantage. It's literally thousands of dollars a year. So the prior session I described Medigap. This session, Medicare Advantage. The question is, can you easily switch between the two? So, from Medigap to Medicare Advantage, you can switch during the annual election period. Okay, so I'm going to presume here that you've already set up on Medigap for whatever reason. You can go to Medicare Advantage between October 15th and December 7th, as you can see. If it's not the time that you turn 65, then you can make unlimited number of changes between October 15th and December 7th. You can literally change your mind among the 60 plans in Miami-Dade County every single day. The last one you choose on December 7th will be the one that's in effect on January 1st. The second line is kind of more important in the sense that Medicare Advantage to Medigap. So now you've listened to the explanations and gone through the sessions. And you've thought to yourself, I still would rather, now that I understand these inherent differences and I've thought through the cost with Jay, maybe now I should be out of Medicare Advantage back to Medigap. Okay. So, in addition to the idea that there's going to be medical underwriting, which I've already discussed in the Medigap session, the fact of the matter is that you've got to go through the underwriting and there's a calendar consideration. And the reason is not because of the health care part, meaning your access to health care providers. It's not because Medigap carriers will not accept you. The problem is you can't cancel Medicare Advantage. And one of those reasons is the calendar doesn't allow, and the regulations don't allow that until December 31st. The second reason is that because Medicare Advantage largely has Part D, you'll be canceling out of Part D as well. So this is why it's never my thought that you do these things alone. You're going to want to have timing matters. In addition to that, because you have underwriting, you need to get accepted by Medigap first before you go back and cancel your Medicare Advantage plan. The last outcome I want for our clients is for you to have the federal card by itself, because unlimited out-of-pocket maximum. There's this extra session. It's there in the second section called the Medicare Advantage Open Enrollment Period. Now, I detest this label, but no one asked me. January 1st through March 31st is another bite of the apple on an annual basis. So this is only for those persons on Medicare Advantage. You do have the right during the first quarter of any year to switch amongst Medicare Advantage plans. You can also cancel your Medicare Advantage plan and pick up a Part D plan by itself. I generally don't think that that's a good idea unless you have been accepted to Medigap first. Because what you cannot do during this period is you cannot cancel your Medicare Advantage plan, switch to a Part D plan, and then switch back to a Medicare Advantage plan in that first quarter. You cannot do that. The last point in this slide is important, which is that there are exceptions. For example, there's the largest one, which is that if you have extra help, meaning the limited income subsidy, something that I mentioned under Part D, Let's see if we can get there. Yes, under here, benefits of the Extra Help Program. If you are qualified for this, then you get additional extra rights to change amongst Medicare Advantage plans. And more to the point is the idea that there are many, many side doors to go from Medicare Advantage to Medigap. For example, somebody moves. You move out of the state and you move to a different location where your plan doesn't exist. Your Medicare Advantage plan doesn't exist. In which case, you get a special enrollment period, a side door. In which case, you can change from Medicare Advantage to Medigap. In fact, at extreme levels, you could see you live on the state border line. You move to the next neighborhood, staying in your location, basically, and yet just changing your state. You get your pass into Medigap. In certain health situations, this might even be advisable. So even though it's an extreme example, it's just an illustration of the flexibility. And the general principle that I mentioned throughout the book and at the beginning of Medicare ABCs, which is these options are in the buyer's favor. Buyer's favor. They're not tricks. They're not traps. They're not this. They're not that. In fact, the details are in the consumer's favor if they knew how they worked. We don't have time. You don't want to hear every last possible exception. I'm just saying there's a very long list, and they are in your favor if you understand the implications. Before I conclude this session, I need to spend a few moments about the extra benefits. So generally speaking, today in Medicare Advantage, there you can have very light dental and vision included inside Medicare Advantage plans. In addition to that, many Medicare Advantage plans, if not most, are offering additional amounts of dental and vision and perhaps hearing aid coverage at additional cost. Now, I don't have a stake in this game because the reality is that commercial reality is I don't get paid any extra. It doesn't matter to me. It does matter to certain consumers. The reason is that dental, vision, hearing, this is a very fragmented set of carriers, or meaning healthcare providers, meaning that with Medicare Advantage company number 1, they may have a different network than Medicare Advantage carrier number 2. The terms and conditions can be slightly different. It can be worth it to actually change amongst Medicare Advantage plans based on this alone. Because like I said at the beginning of this session, the market is so competitive that what ends up happening is the finest little points in here can mean hundreds, $1,000 a year to you in extra benefits if you're choosing carefully. For that, I don't have a crystal ball because, as I said, this is still annual contract, meaning that the arrangements, these little details can change, which can unlock additional benefits for you if you're carefully watching.